Sounds like we are ready to get started. I think we still got folks kind of signing in, but we'll get rolling because I know after the last webinar that we did that there was a lot of interest and a lot of questions. And so I want to just jump right in. Some of you who attended our previous webinar will recognize Dr. Shrika Adams, who has over 15 years of administrative experience in higher ed and student affairs. She served as Virginia Tech's Associate and Senior Associate Dean of Students from 2007 until 2017. She convened the university's care team, supervised the dean's advocacy response team, and is an assistant professor of practice in Virginia Tech's higher education and student affairs program. We heard from Shrika just a few minutes ago that she's wrapping up her final classes for this semester. So yay, that's exciting. She's published in the Journal of Student Affairs and Research and Practice, and her research centers on case management in higher education. So welcome to Dr. Adams. And then we have Dwight Burke, who served at Colorado State University for over 37 years, including 13 years as the current director of support and safety assessment. He's helped develop and establish the institution's crisis team and currently oversees threat assessment and management, early intervention strategies, and security clearance and other related investigations. So excited to have that perspective on the panel today. So welcome to Dwight. And then we have a new face today as well, Dr. Harry Rockland Miller, who spent 22 years at UMass Amherst. He led a multidisciplinary university clinic providing short-term psychotherapy, psychopharmacological services, community consultation, training, and 24-hour crisis services. For 16 of those years, he also served as Associate Director of University Health Services and as a key player in the evolution of a coordinated campus crisis response, and initiated or co-initiated many of the key response structures that are now in place on campus. So someone with a sort of a clinical head and clinical mind, someone with a support and safety view, and then someone with a more of an administrative approach as well. And someone just said Rams. Yes, indeed. Dwight Burke, the CSU Rams. Yep. So we're going to jump right in. Harry, I would love to have you start and kind of kick us off with why is this topic important? Why are so many people signed up and interested? And why is it important that we start and continue this conversation?
Thanks, Nora. And what an honor it is to be here with all of you today. Thank you. It's so interesting to have you all in the background, not being able to see you, but I know there's a lot of you out there. We are all acutely aware of the level of distress among many of our students and the level of attention that we're paying to it today, which has really shifted over time with reduction in stigma, increasing conversation. It is up to us to do everything that we can that's reasonable to reduce barriers, to increase access, to be able to allow students who might otherwise not seek our services, who might be distressed, to seek our services, to reduce the silos, lower the threshold, so that students of color, underserved communities, disabled students, LGBT community, others who just may be reticent for lots of cultural reasons or other reasons, how do we access them? How do we bring them in? How do we create a community of care and partnerships across our broader communities? Because none of our offices can do this alone. I think one theme we're going to hear today is how creating a community, reducing barriers and partnerships, both within our college and university communities and with our partners that are external to our schools that work with us, how we have to build those bridges.
Mm-hmm. Absolutely. Yeah, no, I think that was very well said. And I think all of us would agree that really the more community and support we can offer, the more we might actually be able to prevent crises instead of having to respond to them. And exactly. I think that's really ultimately the goal, is putting the right people in the right places to make that happen. So when it comes to crisis response best practices, let's start with talking about the challenges. This is a hard thing to build, right? Shrika, do you want to jump in here? I know this is something that's near to your heart.
Hi. Yeah, it's great to be back and to be back with everyone virtually again. When I think about probably one of the larger challenges, it's the fact that I think higher education and crisis management very often is reactive, as you have already mentioned. It's responding to incidents post-crisis and doing, briefings and reviews, which is all part of a crisis management process. However, it would be great if, we as institutions could think proactively with regard to campus, to crisis management, and have really a campus-wide investment. When I think campus-wide investment, that's perhaps increasing staffing and having more dedicated folks to respond to big crises and small crises, right? So, can there be embedded case managers in different places? And, we understand that depending on where you are in the country and what's going on with state budgets and such, additional staffing, might not be the most immediate response, but to somehow evaluate that commitment, that large campus commitment to having those support services on the ground. And even for the folks that are already doing the work, to have supervisors, for example, department heads, vice presidents, kind of those leads, taking a look at position descriptions, for example, just to take a look at even things like case balances, so if there's one case manager for 10,000 students, that's not enough. And so I think those are things, probably some of the biggest challenges out there, is to make sure that from the top, there's a commitment to case management practices and crisis management practices, and having enough folks out there.
Mm-hmm. Dwight, I know you've done some work kind of looking nationally with, what universities are doing what colleges are doing what. And I wonder if, what's the sort of state of the state, I think, out there? I mean, I guess we all sort of think of, this is, since Virginia Tech. I know we started that off in the previous webinar, where everybody's kind of gotten up to speed. And I'm just curious if you have thoughts or expertise around that.
Yeah, I think, the best practice, clear expectation is that these teams exist. And I think historically, a lot of these teams have been very student focused. And so one of the best practices right now is institutions recognizing that these challenges go across their population, and making sure that they've developed systems that hit all members of their community, including faculty, staff, or visitors and parents. I think another practice that is a challenge for a lot of institutions is incorporating within their record systems identities and getting identity information as part of the individualized review, right? So when we've gotten pretty good, as I look at a lot of the peers out there, saying we're going to do this individualized review, but oftentimes that's not really done through an equity lens, where we're looking at those individual identities and what those identities add or detract from the issues at hand, and then creating robust systems that incorporate that in our response. And then I think that's also one of the challenges, is our response, and these custom tailored responses that we need to be effective in this work needs to have those pieces in there. But so often I see what I refer to as decision-making models that are flawed. The research, and I think even some of Harry's literature from a decade or so ago, talks about this balanced decision-making and balanced approach, where I advocate is where we're giving due consideration to the individual, as well as the institution, as well as the community. And that's how we come up with a decision. But so often our hierarchies flip that model and say what's best for the institution first, and then secondarily what's best for the community, and then finally what's best for the individual. And that is a poor practice, in my opinion, that leads to increased risk in some cases.
Mm-hmm. That's an interesting point. As you were speaking about including identities as well, it strikes me that one type of identity that I don't think is typically included is disability status. So I don't know that most places would say, this student uses a wheelchair, or this student is hard of hearing, or something which could put them in a minority group that then may need some special accommodations when you're engaging in a crisis response, or may not be behaving in a way that's expected because they can't hear what you're asking them, or they can't move move in the way that you're asking them to. So it's an interesting piece that I think Harry may speak to a little bit later as well. So what stakeholders should be included? Who should be on these broader care teams to make sure that everybody's represented? And maybe Harry, I'll let you start that one. In part because, just talk a little bit to us about how UMass thought about this, and how did the team evolve, and who did you involve? And I'm sure that probably changed over time as you gained more experience.
It absolutely did change over time, and I'm sure it's still changing. I mean, all good processes are evolutionary, right? We learn, we iterate, we learn a little more, we modify. But clearly, there are some core offices that should be on such a team, with many other offices should be having easy access as needed. Dean of Students office is typically the cornerstone office, right? They are the support office that is hearing about things around student affairs and around the campus. The counseling center is another critical member. They're often constrained by certain issues of confidentiality, but they can consult actively without violating any sort of privilege, right? Mm-hmm. Residence life, the campus police, disability services is an important member there. Many students who are disabled or have psychological disabilities are presenting at the care team. Very frequent. And the nature of disability services over time is they're increasingly seeing students with psychological disabilities as a major part of who they serve, right? You may have advising that is a campus presence on the teams. Cultural centers, some representative cultural centers should be there. And depending on your campus, you need to know your campus. Are there other crisis centers? Is there more than one point of crisis presentation on the campus? Many campuses have multiple points where student in crisis may present. If a student presents here, does someone else over here know about it? How do we coordinate our response? You may be each holding different pieces of information that as a whole gets a very different picture than smaller pieces in part. How do we bring in representatives or some active communication with our community hospital? We can speak more about that, in community crisis centers that are off campus. So all of these offices are important, and others that I haven't mentioned, depending on the nature of your campus. Faculty representation in some sort, although faculty can be very separated out and often not have a coordinated communication, but some representation there as well.
Mm-hmm. And I think that's something that I worry a lot about in terms of as we transition into hybrid care and into third-party telehealth and things like that. We cannot replace the folks on the ground on campus, but what we can do is integrate those new types of services in it, but think of them as a stakeholder as well. I think that's really critical, or even off-campus providers generally, to be able to get them looped in and make sure that the releases are in place and things like that can be tremendously helpful. Dwight, Sharika, do you have more to add to the question of which stakeholders should be included?
Just with regard to, as Harry mentioned, by invitation, I think we're going to cover this a little bit more, but, by invitation, if there are off-campus, if incidents occur off campus, then, certainly apartment complex representatives and folks from housing systems within the community, definitely.
Mm-hmm.
As well as the local police departments, but they may be not the campus police, but there often is a community police department who interface with our students who are living on campus.
Mm-hmm. For sure. And I'm curious how that's going to extend as more campuses offer, again, like online classes and things like that. How do we loop in those communities that may not be located exactly locally? How do we think about that as we sort of plan ahead? What about action steps to bridge the gap between campus and the community? How do you build those relationships with, local hospitals, with outpatient facilities, with local police and things like that? I'm sure that each of you has played a pretty pivotal role in your work life, making those kinds of connections. And I'm just curious if you have specific techniques or specific steps that you recommend for those folks that are kind of starting to figure out, how do I do this? So here I am, I'm on this campus, I'm trying to build this team. What do I do? What do I actually, what is the action that I do to start to build that level of community and team involvement?
Well, I can start us out. Sometimes it's the simple act of meeting people for a cup of coffee, right?
Mhm.
Getting to know people, having lunch, having the relationships with people so that when the crisis occurs or the pre-crisis, you could just pick up the phone and say, hey, Sharika, hey, Dwight, let's talk. And we have a relationship already established, right? With our local hospital, because of that sort of work, I eventually was invited to be a member of the hospital psychiatric crisis committee. So every month, and it was an effort, I had to drive over, park, walk in, but every month I'd be there in that meeting with all the key players, maintaining those relationships and being able to keep fluid. Similar with our community crisis center. Massachusetts is separated into catchment areas, and each part of the state has its own crisis center. So I was over there regularly, or vice versa, just talking about our issues. And we established a protocol where our on-duty clinician would speak every morning. One of the first things you would do is speak with the community crisis clinician. Were there any students seen on the overnight, pending permissions and emergency and whatnot, consent, to team up. So we kept really present and current. Getting out into the community is important.
Mm-hmm.
I was going to say Harry and I would then have lunch together, because that's exactly what I was going to say. Very deliberately, when I was in the Dean of Students office, the semester would end. So right about this time next week, I would every year make a list of who are partners, perhaps that I hadn't seen in a while or had lots of contact with, for example. And once a week during the summer, when perhaps administrators might be more free than during the academic year, I'd connect with one person a week. And it was, honestly part of my own professional development and making sure that those connections are made and maintained during the in the office. And then also towards the end of the summer, I would, update and contact those offices to ask who the new hires were. And so that, so that our contacts and our directories were up to date going into August. So kind of a May to August checklist of things to do were the ways that I maintain connections, deliberate connections.
It's interesting to do that over the summer too, because that's a time when you're right, there are more folks that are more available and fewer students on the ground. Dwight, how about, forming liaisons with police departments and with local police and those sorts of things? Do you have any thoughts about the best ways to approach that, or ways that maybe CSU has done that are unique or that are working well?
Yeah, it can be a challenge. And I think depending on where you're located, you'll find relationships that are very, very close knit to very distant and off-putting between departments. And so for me, I think one of the tools, this relationship building that we're talking about, sometimes is a value proposition. And when you go into trying to create those relationships, so often in higher ed, we're going and saying, can you do this for us? And we're failing to mention what we can do for them. Right. And so police departments are often looking for other avenues to hold behaviors accountable that they're in, knowing that there are failures within the criminal justice system, and they're well aware of those failures, and they know that just writing somebody a ticket or arresting somebody isn't going to solve a problem. And so when we go in with the value add to them, saying, when you tie back to us, here's all of the resources that we can then offer and pour into this situation, I think that helps drive those relationships even more. So yeah, have a cup of coffee and then offer that value, and I think it goes a long ways.
Yeah. Harry, when we were kind of chatting before as we were prepping for this, you mentioned the UCLA model. Touring the campus, going to every department. Can you speak to that just a little bit more for folks that might not be familiar?
We wanted to consistently get out on campus, and I mean, UMass is a really big campus. It's a lot of students, and it's geographically large. I mean, walking across campus takes some time to get. So you could work on the campus for 10 years and potentially never lay eyes on someone else who's been working there for the same amount of time, right? So UCLA developed a maroon folder. We're seeing more of those now. It's basically resources for recognizing students in distress. What are some critical things to look for? who are the key offices that you go to, the key resources, all summarized. So we did our own version of that for UMass. And the vice chancellor and I, we basically, each time we did a new version of it, we went on basically on tour around the campus. And we went faculty department to student affairs department, all around the campus. And it was so rewarding because when I would go down to the campus center or walk around, I would see this maroon folder on people's clipboard all the time. People would carry it around with them. It was a valued resource, printed resource. And yes, we have a lot online today, but there's still a value to having things in print that you can have right with you on your clipboard or in your notebook. And those conversations, each time we did a whole nother round, just proved to be really valuable, both for relationship building, getting accurate information out there, letting people know that they really could seek support easily and how it's done.
Mm-hmm. Who got those? It sounds like folks on campus. Are there also, and I think, Dwight, I wonder if you can speak to who are the folks off campus that you would want to have those resources that you'd want to make sure are looped in as part of that whole community?
Yeah, I think, we tend to be very resource intensive, which sometimes means that it's a maze for people who aren't familiar with the system. So for our off-campus partners, really, I like the idea of having a point of contact, a one-stop shop where they can bring concerns, and then those internal to the organization can route that maze of resources to find the right solution. So I whether that's your off-campus life department or something like that, or your dean of students, or whoever that liaison is, I kind of like the idea of having a specific location for them, so that they're not trying to research all the different avenues and try to make their own decision on appropriateness. Let that be the institution's decision.
Shrika, do you have any more to add there in terms of other folks in the community that need to be looped into this whole sort of complex?
As I think potentially not in the immediate kind of nexus of the care team or behavioral intervention team or whatever you're going to call it, but as far as resources, excuse me, I would also include local faith communities for students, and community members that might need a resource, and also update those. And I was thinking also, I'm going to say taxi systems because I'm going to age myself, but ways for students and other community members to get around town. So back in the day when I was in the Dean of Students office, we would also give updated information and check in yearly with our different taxi services around town. Just to make sure, almost anything that our students would use off campus, we did our best to have some level of familiarity with them, and even like a professional development of learn to ride the transit system. If you've never been on the bus, it's hard to tell a student how to get on the bus. So it's even those sorts of things when you think about how to make those connections that are important.
I would think also, if we're talking specifically about treating, working with minority populations or LGBTQ populations, getting connected with their student services. And you'd mentioned faith communities, there may be certain groups of students who are more likely to be connected to a faith community, perhaps even more so than to the campus. And so, getting all those folks talking about mental health and resources, I think might be another way to kind of keep everybody on the same page. And Dwight, I really like your idea of having a single point person, so that it's just very clear. If I need help with something going on at CSU and I have a concern about a student, I have a pretty clear idea of who I could go to first, no matter whether I'm someone in the housing community or somebody on campus. What about working with law enforcement? I know this is something that we all have to kind of build and learn. How do we do this? How do we do this with minority students? How do we do this with all of our students well in crisis situations? I wonder if we can speak a little bit about the concerns that exist for students of color, for LGBTQ plus students, for international students, for students with disabilities, and how do we go about setting those students up and setting our police folks up to be most successful in whatever the goal of that encounter is? Dwight, I might call on you first here, since this is probably the closest to your expertise.
Yeah. Yeah, I think if I knew all that answer, I would be doing a lot more than this webinar, but it's a real challenge, but one that I think needs a lot of time and attention. The real issues that we have with law enforcement being our front line for welfare checks, for those safety checks, particularly in our marginalized communities, it's a real problem, and we don't have a great alternative. When somebody has reached those standards where we need to call a welfare, we can't send clinicians directly, typically, until the scene has been deemed safe. You can explore a co-responder model. We have one, we love it. I would recommend folks look into those, where you've got a clinical person embedded with the police, so the police can back out as soon as possible and put that clinician up front then to deal with that in the field. But education, talking about the issues, working with the departments on awareness and training, and updating their language, updating their approaches, even things, it's a constant conversation around, when do you handcuff somebody that's going to be transported? Most police departments are going to say that they have to by policy before they put somebody in the back of their car. But that doesn't mean they need to take them out of their home or out of their apartment necessarily. It might, that's a department by department conversation, but having those conversations and I think creating liaisons within those agencies then that can advocate for flexibility in their processes. Most of their processes, they've got a standard operating procedure and they're going to follow it no matter what, but they also have discretion. And so advocating for them to use the discretion authority they have to make some adjustments when appropriate goes a long ways.
Mm-hmm. I know we talk a lot about that warm handoff, and Shrika, I'm wondering if you can speak to the kinds of things that you recommend we think about or we include as we try to create that warm handoff when police do need to be involved.
Yeah, as Dwight was talking about, a co-responder model, I think the word that popped into my head was advocate. Like 4 different underrepresented communities on your campus, like who is your go-to person that might be able or willing to respond after hours if there is an issue with or a concern with an international student, or with an LGBTQ student, or with a Black or African American student. Like, is it a student advisor? Is it somebody, if it involves NPHC and Greek groups, is it an alum advisor, and not even somebody from the institution? Like, even when I think about kind of those after hours responses, there was a point person, and they got included on my summer lunch tour. Who's the person or groups of folks to call? And sometimes it's even a matter of just asking the students themselves. If something goes down during the school year, who do you want our first call to be if you need help? And listening to what they have to say, and then doing it. And then, then you build out kind of in concentric circles these these avenues of support, because then you're inviting advisors, then you're inviting, off-campus folks, and then you're, getting advocacy teams, not only of, administrators and folks that are kind of front lines, if you will, but also within the community and off-campus groups at the recommendations of the students themselves.
Mm-hmm. One of the things that's been a real challenge in getting a large provider group, right? Because we're kind of overseeing this large provider group, being able to respond and do this warm handoff has been, we've kind of, I don't think we've solved it, but I think we've approached it by templating that response, so that making sure that the way the chart's set up, there's always someone that's an emergency contact that's identified at the very beginning when we first, meet that student. I love your way of cloaking that, not as, who's your emergency contact, but if you're in trouble or you need help, who is the best person for us to contact to help you? I love that way of cloaking it. I think the other thing, though, of just making sure that those responses go down the same way for every student. So we're doing a warm handoff where, we actually have designed a protocol where these are the things you need to go through before you call the police. Here are the pieces you need to try. Here are the alternative safety measures you might be able to take. And then when we bring in the police, here's how we do that. Here's the language that we use. And we actually templated this out for providers so that, because they're working across a broad variety of police interactions, so across states even. And so it's sometimes hard to have those individual relationships, but making sure that our providers are really well equipped and have a support person helping them understand how to make that warm handoff, what pieces need to go in there. And we scripted out, and we actually modeled this after Michigan State's emergency response team, where they have a little blurb that they have their providers say that says, this person does not have a history of violence. We have no reason to believe they have access to a gun. Here's who they're living with or who might show up at the door, and then guiding the student through that as well. We'll ask the police officer, what does the person look like who's going to come to knock on this person's door? When will they be there? Who will be with them? And can we know in advance whether they'll need to be handcuffed or won't need to be handcuffed, so that our provider can be that warm handoff person as well, as we negotiate that. A little bit easier, I think, if you're in telehealth, because obviously you've got the person on video, and so we can literally talk three-way. But I think all of those pieces, having that sort of standardized response, so we're not reinventing the wheel with every situation, also I think enables every student to get that level of warm handoff support and care. Yeah, Sharika, go ahead.
I was about to say, I don't know if I need to raise my hand, Nora.
No, go ahead.
I hear what you're saying, and I'm processing and a little bit challenged, because I think depending on the group that you're working with, students are going to respond differently based on, certainly cultural differences, lived expectations of the individual, but also the group. So yeah, I definitely, I hear what you're saying with a standardized response. I think a way to help smooth that over is also something else that we've done in the past, is going to those student organization meetings, for example, at the start of the academic year, to talk through that. So, you know what, if it's a Friday night and you're at a party and, the police show up and something goes down, here's what's going to happen. And so, know what, on a Tuesday in August, for if it happens on a Friday night in October. And I think, again, being transparent and helping students and community members on the ground understand what's going to happen up front in advance might be one of the better ways to help manage what's a difficult situation at any given point.
Yeah, I think that's a great point that you're making. I love that idea of allowing students, when they're not in crisis, to think through what might be most helpful to them, and then try to speak to that as you navigate the crisis. We have a question that at one campus university, police respond to all suicide threats, and for BIPOC students especially, this can be really frightening. I think maybe it's more of a comment than a question, but this person is talking about mobile crisis teams and whether and where those can come into play. I'm wondering if any of our panelists have experience working with mobile crisis teams or using mobile crisis teams.
I started my career on a mobile police
Okay.
crisis. Actually, probably one of the first in the country back in the early 80s with the city of Berkeley. And we worked very close. We were mobile, we were in the community, we would work with the police as needed, we would be co-responding. And those sorts of teams didn't really take off for a long time, but now we're seeing an explosion of them. So many. Some universities are now starting to do it as well, and communities. Town of Amherst, right where I am right now has a team. Northampton across the river has a team. So these are really valuable. But on campus, most campuses don't yet have such co-responder models, although I think we're seeing them increasingly, and I expect that we're going to see more and more of them. I think similar, Sharika, your point around preparing students, letting them know what to expect in advance. Reciprocally, I think if we're going to call upon the police, can we let them know what to expect so they can do the best job possible? This is a person who's very frightened, who's scared, who's had bad interactions with the police in advance, or who might be aggressive, so the police could respond appropriately. Or if people oftentimes feel that it's confidential, it's private, I can't really share some of this stuff. But frankly, if we're calling a colleague, a police professional, to respond, don't we owe it to them to give at least enough information so that they can do the best possible job to reduce the chance of something going amiss, right?
Yeah, absolutely. Yeah. Sure. Go ahead, Dwight.
I might just jump in real quick. And I think for your staffs who may have the responsibility of calling in for those welfare checks, certainly anybody can call in, but some staff have a higher probability of being the ones to call in. Educating them on how to give good context and history to the dispatch, and then conversely having your dispatchers trained to take just that little extra time. I've had lots of years working within and around the police departments, and so often it's, okay, what's happening right now? We're going to deal with the here and now. That's what we care about. And what's really important, though, is the context and some of that history. But they don't have 30 minutes to listen to the entire history, right? So training your folks on how to give a very concise, good context so that some of those big questions that law enforcement have when they're going to a scene, the big unknowns that they have to protect for, can start to be answered. And then the tone of that interaction starts to change pretty quickly. So it's a complicated issue. It's a protocol issue that's not an easy one to change. And so I think it's work in the fringes. You keep working on the trainings, you keep working on the response, you train your community, you train your individuals, and you just keep working on that issue on a regular basis.
Yeah, I think that's something that Michigan State's done a nice job of. And I think Shrika, to speak back to your point, I think in the pieces that are sort of templated, I think, and again, we modeled this after Michigan State, that idea of here are the key pieces that you need to relay in this order, and here's what you need to make sure that you say, can be really helpful, I think, to providers who are kind of in a crisis situation, trying to handle this as they go. Dwight, you mentioned training. So what sorts of resources, what sorts of training should institutions be providing to students, to staff, and to administrators? Sharika, do you want to start us off with this one?
With regard to, could you repeat the end part of your question?
For with regards to working with diverse student backgrounds and populations and having cultural sensitivity, what do you think that are sort of the basics that institutions should be offering to their staff, to the folks that are part of these teams?
Yeah, I think, and I know I've thought about this in advance, knowledge is power. So I think sometimes even just the basic information. So lots of times there aren't even conversations about what are the demographics of our campus community. who is here? What are the needs? What do our student populations look like? What are the resources that are out there and available? Lots of times, human resources for the university have things like professional development opportunities to work on like allyship and ally training and DEI opportunities that can help enhance skills for folks. And then even, local opportunities for, crisis management trainings, maybe by, if you think about domestic violence, sexual assault, response and crisis centers and those sorts of things, those are ways to get training and such also.
Mm-hmm. Do you think that we need to, I guess ask this of the panel, do you think that we need to change protocols or adjust protocols to better support the needs of underserved student populations?
I think every situation is an individual situation, right? We have broad ways of approaching things, of course, that makes sense. But then we have to look at each person and each situation in the context and what is right for this person, for this community at this time. Right?
Mm-hmm.
If we fall too much, like we have to have policies, procedures, and protocols. But if we start following those by the book and to the letter, we lose so much. Right? We have to be able to customize.
Yeah. So it's really about flexibility, it sounds like. So you have that basic structure, but then you build the flexibility into it. Dwight, shifting gears for a minute, in the last 6 months, Northern Colorado has established a community-wide threat assessment team. And this incorporates community mental health groups, providers, businesses, representatives. It sounds like from K through 12 and higher ed. Can you just take a minute or two to kind of talk about why this exists and how this has been built?
Sure. So there's been some successful community teams for some time across the country, and they're gaining in popularity, and there's starting to be some federal focus coming out through Homeland Security to push these teams. And so I think more and more communities are starting to see them get set up. The challenge, there's big challenges with community teams, and one is record keeping, and there's a lot of laws around record keeping in the community situation that they need to work through. And the other is going from just an information sharing to an actual management group or a group that actually offers some mitigation or intervention in the issues. So I think the fact that you get your community recognizing and talking, and then you get all your partners being aware of how these issues interconnect between all of their silos that exist in the community. I mean, we've been talking about silos in higher ed, but they're all over in our communities. And so you start to do the same thing we've done here is break those down, get people talking, they start to know who to call. And then you can start strategizing. Honestly, I think a lot of the community teams have less sophistication because they have less level of community resources, right? We don't have dedicated case managers. We don't have availability in the psychiatry appointments and all that often we do in higher ed. But it's that same process of getting the folks talking and trying to get in that early intervention and prevention work where we can make a difference.
Mm-hmm. For sure. I think we're actually getting to question time, to questions from the audience. So I'm gonna shift in that direction, unless anyone had a final comment that they wanted to make before we shift gears. No, we're good. Okay. Go ahead, Harry.
So many of our institutions, for good reasons, are concerned about liability. We're worried about protecting the institution. And Dwight made some comments early on in our conversation about looking at the needs of the community, the institution, and the individual. I would argue that if we do right by our students, we meet them where they are, we meet their needs, we work on relationship, we provide good care, that's the best protection, liability protection we could possibly have, right? Mm-hmm. If we're just operating from a reflexive liability management perspective, we lose the individual and we lose the student. Let's provide the best care, and that's the best protection for the university in any case, most of the time.
Yeah, couldn't agree with you more. I think from a medical legal perspective, that's shifting as well, right? We went from you call the lawyer and you lock everything down to you do what's best for the patient. And I think as clinicians too, right, we have an ethical obligation first. And so I think that if we are fulfilling our ethical obligation, we're probably going to do right by the student. And you're right, we're probably going to decrease our legal risk in doing so. Any other comment before I switch to questions?
I might just throw one quick add-on on what Harry's saying is I think the courts are telling us this as well. As you've looked at the, and I'm not going to play the lawyer because I'm not one, but if you look at that legal environment and how it's evolved over the last 20 years from the you are protected, these are adults, they make their own independent decisions, and that movement towards you better take appropriate action, you better show that culture of care. I think it's in the cards clearly to be read from what's coming out of the courts. And so I agree wholeheartedly that, you know, if you think you're trying to protect liability, you're actually increasing it when you're making decisions based on that.
Mm-hmm. Actually, I think our first question reflects on this quite nicely. This is from a staff member at a UCC standpoint. It feels difficult to hold the balance between confidentiality and other campus partners' needs or wants to know what's going on with a student, like, you know, after they made a report and those sorts of things. I wonder if this person is asking, can we comment on that? Can we provide some insight around that balance?
I think it is a difficult balance, but it's also usually pretty clear. Like those limits on sharing and confidentiality are embedded in the state law or the ethics, and it's usually pretty clear. And so if there's tensions there, where I default is that it's often about educating the partners on those limits so that they can be respected. That said, for those that are operating under that confidentiality, I think it's important to clearly understand the limits and the exceptions and be willing to interpret those in a way that still goes towards the overall safety. You know, and any time that there's a limit on confidentiality, if you put 10 people in the room, they're going to draw the line in a different place. And so internal to the organizations that hold that confidentiality, I think some good centralized training on where do they want to draw that line that one, honors the confidentiality, but still contributes to that safe environment. Because I don't think any provider wants to draw a line of confidentiality that led to some kind of a mass event. So making sure that they're really comfortable with where they're drawing those lines.
Mm-hmm.
Sri, you want to go?
I was just going to say, I think that sometimes a general answer will suffice, in that if folks understand, you know, the process. So certainly, you know, don't violate confidentiality, but if you can speak in generalist terms of, you know, in situations such as these, these are the things that would most likely happen next. 8 out of 10 times I've found that works pretty well.
That does work pretty well, and most of the time. From the mental health perspective, from the mental health provider perspective, we are obligated legally and ethically to maintain the privacy of the communications we have with our clients. And that ultimately works for the safety of the client and the institution when people can talk out things in a private way. That's it, because we can reduce risk, we can step in. That said, when there becomes an acute, and sort of echoing in a little different words what Dwight was saying, when there becomes a threat to the individual or to the community or to somebody else, we have an obligation at that point to step in. And whether we're looking under HIPAA or FERPA or state confidentiality laws, there are always exceptions to privacy when it comes to acute safety risks. We saw that laid down way back, in the Tarasoff case, which sort of talked about that very tension point, right? And that has been continued to be developed in our courts and in our laws and our statutes ever since. So when there's a threat to safety, we have to sometimes break confidentiality.
Yeah. When I always try to think about what is, if I share this extra piece of information, what's the benefit of that? And what's the risk of that? And the risk of that is someone gets hurt, then I share that bit of information. But if the risk of, but if I'm thinking this information is not actually relevant to this particular stakeholder, it's not going to make them able to do their job better, that's when I don't share that information.
I once had a mental health attorney, and when I was in a real dilemma and I consulted with a mental health attorney, he said to me, Harry, would you rather have a violation of confidentiality suit or a wrongful death suit? Where do you want to sit right now?
Yeah, that's absolutely true.
So in our documentation for the mental health providers out there, we're going to document the pros and cons in the way that Nora was just talking about. What is our thought process?
Yes.
Lead us to do that. And that's always defensible if we're operating in the sake of safety.
Yeah, absolutely. And I think, Harry, you make an excellent point in the fact that clinical thinking should be documented. I thought about not sharing this information with fill in the blank, but realized this could be the outcome of that. And I think that the risk of this violating this person's confidentiality is lower than this risk of harming someone. And that's the best that you can do. That's the best you can do. Shrika, do you have anything else to add here?
I always practice with the mindset of err on the side of care.
Yeah.
And I'll leave it at that.
Yeah, I think that's right. Lots of great questions. It's almost hard to pick which ones to go with here. So faculty, they're often on the front line in recognizing student distress. Thoughts on how to engage and train faculty about their role in this process?
Yes. Jump in quickly. It's interesting. When I went from administration to faculty, particularly having played this role on an administrative side, all the things, and it was surprising that it wasn't caring for students in times of crisis wasn't one of the major things on on faculty orientation, with all the things that have to be covered, right? But it's got to get in there somehow. So I think that when you onboard faculty to the institution, there ought to be conversations about emergency management, crisis management, how crises are managed, and also something that we did in practice was visiting the different colleges, and sometimes even on department levels, like almost kind of an on-demand roadshow, if you will, for not only faculty, but also academic advisors. I mean, you want to talk about folks that are on the front line, particularly at larger institutions. There might be, whole departments of academic advisors that are not teaching faculty, but spend as much time with students. So also not neglecting to train those individuals also.
Mm-hmm. One of the questions that's come up in several different ways actually is this idea of building trust with students, especially when we're talking about marginalized or students with marginalized identities. That trust may be a very good reason why that trust is not there with the institution. And also with police. We talked about, having an advocate for the student that can be called, talking about explaining to both sides what this, all the details of the situation that might make that go better. Are there other things or other ways that folks on campuses are building trust with students, with minority students and other students who may have distrust of the mental health and healthcare approach generally?
I'll jump in real quick. I think one of the lessons that we've struggled with and have maybe learned or are still in the process of learning is this we tout our values, and we put forth these aspirational goals of what we want to be. But I think a lot of times we say, this is who we are. And then students come and they say, that's not who you are. I'm not experiencing this aspirational thing you said you are. And so I think some real transparency helps build that trust. And just that little change of, we aspire to be these things, and it's messy, and it's there's harm that happens, and we're all learning. That goes a long ways to building trust versus saying, we're a safe place for you. And then somebody shows up and they receive harm and they go, this wasn't safe. This wasn't good. So I think infiltrating those aspirations as not that we've accomplished this, but we're striving, and being transparent goes a long way towards building trust or setting expectations for folks on what they're going to encounter.
Mm-hmm. Harry, you had jumped in before. Did you have anything to add?
That was a great answer. And I think I just reiterate what we were all talking about earlier, which is relationship building, getting out in our community and having relationships.
Mm-hmm.
That goes a long way.
Yeah. Shrika, do you have anything to add before I can certainly jump to the next question, because there are many?
I just second what Dwight said. I've been thinking about how to frame it, because very often institutions might not want to acknowledge that harm has been done. But I think that goes a long way if you're talking about particularly communities that have experienced harm, to hear from the institution that, you know what, yeah, historically this has not gone smoothly, or this was not done well, either a long time ago or even in recent semesters. And having those, as we've said, open, transparent conversations to give feedback, but also to receive it is messy but important.
Mm-hmm. Question that's come in several times, I think that's a real challenge, is smaller colleges or universities or community college campuses. Are there particular resources that are available, or particular approaches when you're working with really, really limited resources, and folks and departments on campus? This is a hard question. I think this is a question that kind of stumps everyone. How do you do this, right? I think I'll jump in for just a second, and then Shrika, it looks like you were ready to say something as well. Well, go ahead, Shrika, you go first.
I'm just kind of musing, I think the organizational structure of smaller institutions is such that folks wear multiple hats in the first place, and this is yet another hat to wear, right? So while I don't particularly have small school experience, I would recommend perhaps going broad. At larger institutions where there's generalist practice, you can go with some level of depth of experience, but perhaps everybody, if you will, at a small school where there might be 25 people in student affairs, maybe it's a core group of half the student affairs team, if necessary, that has bits and pieces of crisis response, as opposed to at a larger institution where it might be an office. So it might be truly rethinking the organizational structure of crisis response, instead of trying to have it assigned to 1 to 2 to 3 people on a smaller campus. That's just kind of my gut response, to think broadly.
Mm-hmm. Mm-hmm. Well, we're coming up to the very last half a minute here. So I wanted to say we will be working on a white paper that's going to be coming out soon that the panelists will be involved in. So stay tuned and keep an eye open for that. There were a couple of questions, Harry, about sharing the content that you put in your folder, so you can think through that. And if you're willing to share that, we can certainly send that out as a follow-up. Or was it Dwight? I think it was Harry, right? That had the maroon.
It's on. If you go to the UMass Amherst website, the Dean of Students page, you should find or a Student Affairs page, I believe. Also, you'll find the link to the maroon folder.
Yeah. Perfect. And then someone asked about the provider blurb that I shared, and I will link you with the person, I think at Michigan State, who started that whole piece, and I think they'd be probably happy to share as well. So we'll send those resources around. Thank you so much, Dwight, Harry, and Sharika. This has been a really, really interesting conversation as always, and appreciate each of you taking the time to sit with us and to think through these issues, and the dedication that each of you has to thinking about these things and bringing them to your local campuses as well. So hopefully we will continue this conversation and continue to take questions. Thank you to everyone for your time.